Hi, good evening, everyone. I'm just waiting for Dr. Gigi to come on here. Hi, Summer. There we go. All right. Connecting with Dr. Gigi and
Hi,
how are you?
I am good. How are you?
Good.
Took my shower, fixed my eyebrows,
Oh my gosh.
a little makeup.
Yeah, definitely COVID problems, right?
I know.
But it did a good job.
Thank you. Thank you so much for having me.
Yeah, definitely. So you're in New Jersey. I'm here in Phoenix, where it's hitting 100 degrees every day. So
Oh, wow.
that's how's the weather there
You
in
know what? Today was crazy. We had a little bit of everything. There was sun, and then there was like snow, and then there was rain, and then there was crazy winds. So it's been just stay inside kind of a day.
Yes. Well, very nice. I'm excited to talk to you tonight and to talk a little bit about what you're doing there in New Jersey with having an office that offers physical therapy, which is what you do. And you work with IBCLCs within that
Correct.
practice. So I definitely want you to tell us all a little bit more about that. So anyone that has been following AZ breastfed babies for a while knows that I talk a lot about body work and how beneficial it can be. And, we talk about the birth process, and it's very easy for people to understand and relate to how someone feels after they give birth and the amount of effort it takes to give birth. But a lot of times we don't talk about what it what's involved in it when it comes to the baby's perspective. And then, certain breastfeeding difficulties that we might see right after the birth could be
Mhm.
simply because of positioning in utero or positioning
Yes.
during the actual birth process. And so I would love for you to introduce yourself officially and talk about your Milk Matters practice in New Jersey, and then talk about how you got started with really focusing on breastfeeding within your practice.
Yeah, sure. I started my practice about 4 or 5 years ago, and it was called In-Home Pediatric PT, which also has its own Instagram handle. But I was primarily treating, all kinds of disorders for little kids from 0 all the way up to 18. And I was starting to get to know a couple of people in the community and going to mommy groups and those kinds of things. And one of the mommy groups was led by an IBCLC, Carmen Baker, who has become a very good friend of mine. But she asked me, she said, "You're a PT and you're known in the community and you're great at what you do, but we need a lot of help with these babies." And so she was sort of the one that opened my eyes to it. And so I went and I took some of the Michelle Emanuel courses and started doing a lot of research. I took some of the Talk Tools courses, and I sort of just branched out and started doing this research. And I found it so fascinating. And in fact, I was surprised that more PTs aren't really doing this kind of work, because I feel like it's right up our alley. So children who are having trouble, or babies and infants who are having trouble breastfeeding, there's usually something that's getting in the way. There's something that's tight. There's a restriction somewhere. A muscle isn't working properly. The timing and the sequencing of the muscles are not necessarily working. And this is exactly what we do. I mean, we help people who have had strokes use their muscles and learn to walk and learn to talk and learn to do all these things again. So to me, it made perfect sense, and it fit right into what I do. And so I started, working with Carmen to help these babies, and the results were incredible. First of all, a little infant, their neural system is like a clean slate. So I can go in there and teach them how to do it correctly, or undo any bad habits that haven't become such horrible compensations at that point. much quicker than I can, when I used to get a torticollis case that was like 8, 9 months old and they had already been delayed in their development. So I feel like it's helped so many ways. So it definitely helps with all of the nursing, but then it also helps me to catch any musculoskeletal or any other neural issues much, much earlier because I'm seeing babies that are so little.
Yeah, definitely. And the, so I find with working with babies is we almost never have a clean slate because even a baby right at birth has muscle memory of what the
Yes,
movements or
what they're doing.
are in utero.
Mm-hmm.
So definitely if it's a multiple pregnancy and we have more than one baby in utero, or the baby is breech, or the baby was just in a certain position prior to the birth, and then again like the birth process. So there's almost always something that we need to unwind. I'll tell
Correct.
parents it's almost like rebooting the computer and then getting everything back online again.
That's
And
right.
I'll have families reach out and they will ask, okay, we're gonna, like, we know the baby has a tongue tie and or a lip tie, and the pediatrician diagnosed it, or somewhere along the line somebody identified it, and they're going to have it released, and they're like, we want to see you after. And I'm like, please can I see you before, because there are so many things that we can start working on even before like the tongue tie release is
Absolutely.
done. And so yeah, I definitely, and here in Phoenix, like in my own practice, and I actually just saw Chelsea from Growing Forward Therapy. She's an occupational therapist,
Yes.
so she also took Michelle's course, which one of the courses she teaches is the tummy time method. So
Yes.
if anyone's looks on my Instagram and on your Instagram, they will see that um, we post stuff from Michelle from Tummy Time Method a lot because it's really
Yeah.
great information. So yeah, that's awesome that
Absolutely.
you kind of rerouted your career as a physical therapist to focus on babies and breastfeeding and all of that.
Yeah, it's been really great. And you are right. I mean, when I say a clean slate, I'm talking relative to like the older kids or the grown-ups that I see. But yeah, in like, if you're doing suck training on a child who's only 5, 6, 7 days old, the process is much quicker than if it's a 3, 4 month old baby. So the clean slate is definitely all relative, but the fact that you can go in and alter that muscle memory in a relatively quick manner just constantly amazes me, that we have that ability to change. And, some of the kids, like you said, they come out, it's been a traumatic birth, or there was some constraint in utero. And a lot of that is normal initially. And, we can see kids that come out with some of that uterine constraint, but after 2 to 3 weeks outside of the womb, just like the effects of gravity should help to relax all of that. And if that isn't happening and they're still having trouble nursing, having trouble moving, if parents are having trouble changing their diaper, getting them dressed, then there may be some indication that something like body work is indicated. And body work can be such a range of things. I mean, I'm a physical therapist, but it could also be an occupational therapist, a speech therapist, a massage therapist, a chiropractor, a craniosacral therapist. There's such a huge gamut of us, but basically the body worker is anybody who has a license to touch and can put their hands on a child. And then we gently, like you said, unwind the tissue, we find the restrictions, we stretch what's tight, and it's really very gentle, and it allows the child to just come to more of a normal state, to allow the muscles that are supposed to be working to function correctly, so that they can, to get a good latch, they need to extend their neck, they need to open nice and big, their tongue needs to come out and down. And all of that has to happen just to get a latch, forget even the seal or sucking or whatever. So a lot of times I'm finding babies have trouble with all three of those things. And just explaining it and breaking it down to parents allows them to be able to be part of it. And when I show them these few little things that they could do at home, it really helps. By doing the guppy, by doing some suck training and all those things, it really allows the process to happen rapidly.
Yeah, definitely. And I was going to say sometimes the birth may not have been what the parents would describe as traumatic. It could be, a home birth, birth center birth, or hospital birth. And maybe the birth was actually really fast. And so
Mm-hmm.
the mom will say, oh, yeah, it was great. Like everything progressed really quickly and I hardly had to push at all. And it was a little intense, but yeah, the baby just came out. And sometimes those babies are the ones that need a lot of, like, the most help. I call them the torpedo babies when they just fly right out. And they come
I
out
like
and
that.
they're like, I don't want to move. Oh my gosh, it was a wild ride. Because part of the
Oh, wow.
movements of, rotating and coming through the pelvis and being born actually helps to unwind them so that they have full range of motion. And like you said, under normal, ideal circumstances, for a lot of babies, it's just gravity and time on the parent's chest they're gonna unwind it themselves. They're gonna lift their
Mm-hmm.
head up and wait there on the forearms. And um, baby wearing, that can really, especially when there's some movement in there, when they're not constricted too tightly. Um, but in our culture, there are some things that can hinder that normal natural progression. And so this is another really popular conversation. And so maybe we could just touch on, swaddling, and
Mm-hmm.
then containers, like appropriate use for both of those things, because just like anything, it's not all bad or all good. And there's appropriate ways to swaddle, an appropriate length of time. And then the same with, using like a hospital or a swing, like appropriate, but knowing
Yeah.
those can hinder some of the movement and that progression of babies being able to work through some of their own restrictions and tension.
Yeah, I think you said it so nicely. And basically, a baby comes out with a natural ability to find their normal and to just they have a natural drive to do these things on their own. So you'll see, these newborn babies, their arms are kind of all over, and they're looking around sometimes back and forth, and they have the ability to stretch things out themselves. I always say, think of us as like adults. We wake up in the morning and we're stiff because we haven't moved all night. And just from us going into the bathroom, taking a shower, brushing your teeth, washing your face, getting dressed, that normal movement helps to get rid of stiffness. So, in the physical therapy world, we say motion is lotion or movement is medicine. And
Yes.
that's exactly the same for babies. So just natural movement allows that stiffness to go away. And so this is what I always educate parents when they come to see me. And so just taking them out of these things that tie them down. When you're putting a baby in a snoo, you're velcroing them in. When you're putting them in a swing, you're putting on a 5-point harness. In a stroller, in a car seat, all these things, you're sticking them into something and they're not able to just naturally move. And they won't move because it's just harder for them, obviously. So they'll end up kind of just being in this position until they're moved out of it. And, my oldest is 12, and I'm sure you know the same. We didn't have that car seat that clicked into the car and then clicked into the stroller and then clicked into whatever, the bassinet. So we at least had to take the kids out. So for a moment, they were able to just kind of move a little bit. But now they're really just the age of convenience, I guess. And these containers has slowed down that process of a baby naturally getting rid of some of the stiffness. And we find in our practice, and I'm sure you do as well, that there's just a bigger incidence of kids who have flat spots on their head. And again, it's just because of pressure from being in something for so long. If you just put them on a blanket and allow them to be on their back and on their side and on their belly, none of these things will happen.
Yeah, definitely for most babies. Sometimes there's some, um, you know, like flat spots on the baby's head, the plagiocephaly or the brachiocephaly that starts in utero. Again,
Yes.
especially if they're, depending on their position, if they were multiples or whatever. But again, like they will do some of their own therapy with movement after they're born. And then sometimes, someone like you, you're going to get the referral for those babies that need that little extra therapy to help them with that. But, a lot of times when I'm working with new parents and in the hospital, the staff has gotten them set up with a ton of blankets, and they're, having them prop the baby on the blanket and then just bringing the baby right to the breast and feeding them. And a lot of times I'll tell the mom, okay, I want you just to cradle and hold your baby naturally, and then just lean back and let your baby bob around and lick
Find it.
their head and
Yeah.
find own, because really that's the part of the breast crawl, right? If anyone's not ever seen the breast crawl,
It's
Google it.
fascinating. Yeah.
There's out there on YouTube of birth and the breast crawl, and how babies have those reflexes to help them move and find the breast completely on their own. And so for a lot of babies, instead of, bringing them to the breast, you just get them in position, and it does look, kind of uncoordinated at first, and they're going to turn the wrong way, and they may kind of fuss and complain about it. But I always tell them, if you let them like kind of struggle a little bit, we're not letting them get so worked up that they're,
No,
crying
hysterical.
and
No.
really, really frustrated. But if you're letting them kind of bob around and you're leaning back and using gravity, and they find the breast on their own, a lot of times you're going to get a better breastfeeder long term than if you're always positioning them, parallel on a breastfeeding pillow right there. Now, there's a time and a place for that, depending on, with certain moms, maybe if they are in a lot of pain after they give birth, or depending on, even their breast size, sometimes having a pillow can be helpful with positioning. So I'm not saying that no one should ever use a positioning pillow, but more often than not, when I can have moms get rid of some of those pillows and just, lay the baby on their chest, you see some really, really magical things happening with the baby starting to trigger those reflexes and that movement. And yeah.
Absolutely. I feel like I think that's just a good tip, a mom tip in general. And I say that at our mommy groups too, that like our job as a mom is to teach your child about this world. Like everything can't be so perfect and robotic for them, because that's just not how it is. They have to learn how to navigate it on their own. And our job is to support them, hold their hand, and bring them through it, but not to manufacture it in that way where they don't have to learn how to do it. And I feel the same way with sleep. I mean, with swaddling, with the snoo, all these things are, helping, so to speak, parents to have the baby sleep longer or whatever. But I do feel it does a bit of a disservice to the baby, because the baby is not then able to figure out how to do these things naturally.
Yeah. I mean, there's a lot of things that we could go over with the stew, and really tight swaddling, and
Yeah.
long swaddling. And sleep is important, and I want moms to get sleep and babies to get sleep, but those long stretches of sleep, especially early on, for most moms and babies, we're going to start to see issues with mom's milk supply and baby's weight at a certain point. So
Yeah.
it's really something that moms should be aware of when they take a class that teaches, let's get your baby to sleep 8, 10, 12 hours. They could be given informed consent that, okay, that you might be able to do that, but you also need to know that you're probably going to sabotage your milk supply. And potentially also really have some maybe weight gaining issues with your baby around that 3 to 4 month mark. Not
Once your hormones level out.
Yeah, there's,
Hmm.
there's outliers, babies that just naturally, no matter what the parents do, just start having long sleep stretches. They're able to get, the full amount, usually around 30 ounces of milk a day in that 12 hours, and then sleep, a lot of the other 12 hours. It's possible, but I, those are the outliers.
Yeah. Yeah, and I don't know if you picked up on it, but I'm actually a Canadian. That's where I was born and where I went to PT school. And I moved here after I got married. But a lot of my friends back home, they get a whole year for maternity leave, some 18 months. And so I feel like in the US, women are just so pressured to go back to work. They have to sleep because they've got to get up. And so they're already stressed and worried about sleep and their milk supply and how their baby is going to survive and whatever because they have to go back to work when really our jobs in that first year should be our baby. And I do hope that that will change with time, but I feel like that's a big reason why these moms are, you know, buying books that say that your 12-week-old should sleep 12 hours, and it just makes me crazy.
And I did go back to work with all three of my kids between that 6 to 8 week mark, even
Yeah, me
having
too.
very in my third. And so I get it. I was working 12-hour shifts and I was working night shifts. So I was up all night and trying to catch up on sleep. And so for me, I found safe bed sharing. And I know that doesn't work for everyone, but that is what ended up working for me with my kids so that I could sleep and that they could continue to breastfeed. And
Yeah,
so, again, I know that's not a good option for everyone, but it worked for us. And I don't,
right.
I don't know what we would have done otherwise with me, going back to work
Yeah.
after.
And I do think the important thing for moms to remember who are stressing, like we've all been there. And I mean, I had my baby in a lot of things that I tell parents not to put my babies in now. You know, I use the bumbo and I use the swing, and now I tell parents not to because it's not good for, movement and whatever. But I mean, it does end up being okay. So, our job is not to add more stress to moms. We really want to help and support them along the way and make it easier. And so sometimes I feel like I'm giving them a big, like, don't do this, don't do this, don't do this. And, it's okay. We are all doing our best,
Yeah.
and,
And what I try to focus on too is like here's what you can do. And so for a lot of my consults, depending on what's going on, but I'll ask them, now if their baby's 3 days old, then this isn't necessarily as appropriate, but I'm like, so show me where your tummy time area is. And where's the mat, like what kind of toy, especially if I'm seeing a baby that's like 6 or 8 weeks old. I'm like, where's your tummy time area?
yeah,
And sometimes they're going and they're pulling like this play mat that they got out of the closet, and I'm like, this is the perfect time to get this out and to start using it. And that can, giving them things of like, here's what you can do, like you can wear your baby and you can put your baby on the floor on a blanket on a safe
that's right.
area. And if you're getting in the shower, like I remember when my kids were little, we did have a bouncy seat. And if I was making dinner or if I was in the shower, then they would be in their bouncy seat, so I could play peekaboo with them when I was in the shower, so that they knew that they weren't alone. Like if their dad was at work and there wasn't anyone there to hold them for that like quick 5 minutes, I just gotta get a shower type of thing.
Yeah,
But we lived in a not even 1,200 square foot house. There was no room for a swing. There was no room for any of that, and so yeah, I just had a good old blanket on the floor, and we
yeah.
just spent a lot of time there. But yeah, I mean, once they get to a certain age, they're not going to want to be in those things anyways. And so then that's when the fun really starts, when they're getting down on the floor and they're, starting to
Yeah.
make those crawling movements, and you have to go around and childproof your house. So
That's right. Right. And I know one of my favorite things is when I get these new moms with these itty bitty babies is to show them how they could do tummy time, and it doesn't even have to be on the mat on the floor. So if you are allowing your baby to be chest to chest, right, or skin to skin, then that's considered tummy time. If you have them in a baby carrier and they're awake, that's considered tummy time as well. And I show them like the Superman position and how to burp over the lap and all those things that I consider, right, so the Superman would be this
Like,
position, exactly, we're kind of both doing it.
yeah.
And then, burping the baby over your lap, where one leg is a little higher than the other. All of those things are tummy time that you could do right from day one.
Yeah.
And I also just like to advocate for babies that I don't like tummy time to be stressful in any way. And Michelle is so good at laying that out and teaching us to just watch for the baby's cues. And if all they'll take is 30 seconds and that's all you're going to do, but you're going to do it multiple times during the day. And so you're not stressing about them, being not getting enough tummy time because you're going to do it in that next like sleep feed cycle.
Yeah, definitely. Definitely. And like on the tummy time method, social media, she talks a lot about better together and getting down there on the floor with your cat and your baby or the other siblings and really making it fun and short, sweet sessions in the beginning.
Exactly.
Even after a diaper change, maybe you're just gonna roll them over and they're gonna spend 10 or 20 seconds like popping their head up a little bit, and then if they get frustrated, you can roll them back out of it and pick them up. But if you're doing that several times throughout the day, it's like little sessions of yoga. And for anyone that does yoga, if you only go once every month or two, like you don't ever get anywhere, you don't really progress. Like it always just feels like you're so
Yeah.
stiff. But if you start going once a week, you're like, okay, this is a little easier. If you start going a couple times a week, like, oh wow, I can actually do this a little bit more. And so with babies, I'll tell the parents that like it really can be just a couple seconds that you roll them over and you just give them a nice little like back massage, or Michelle calls it the hiney helper, like jiggling
Mm-hmm.
their hips and their little bottom and letting them again like just make that motion. They may be super not happy about it and they're like, oh, get me out of here, but you wiggle them a little bit and then roll them out of it and pick them up and try again later. And then eventually you'll see that they do that and they're like, oh, this isn't that as hard anymore. So,
That's right.
and
That's right. And consistency, like you said, is key to them getting it and to you getting it. And then once it's in your routine, you're both expecting it and it just becomes a part of life. And then you see all the growth and development that happens as a result of it. And it's just amazing.
yeah. I grabbed one of my beach balls because I use this a lot for doing virtual visits just because the exercise ball is huge.
Yeah.
Use these in general too, but I'll talk a lot about doing tummy time on either a little beach ball like this or a big exercise
A
ball.
birthing ball. Yeah.
And you can add movement into it, so that'll definitely buy you a little bit more time. Or of course, our favorite, the guppy, right?
The guppy.
Anything that's gonna help a baby relax their neck and their jaw so they can get into that extension that you were talking about is gonna help them be a better breastfeeder.
That's right.
Yeah.
And then also just looking at your baby, because some parents don't notice, but I find a lot of grandparents sometimes pick up on like a torticollis or an asymmetry. So there's some kids that, if they do have one side that's a little shorter than the other, then they're going to have trouble breastfeeding on one side versus the other. On one side, they may not get a good seal because when their head is stuck, they can't, get that top lip up and the tongue to seal correctly. So there's so many ways that getting some body work and relaxing all of that will allow for better nursing.
Yeah, definitely. So someone just asked any advice for older nurslings. So I kind of want more information, like what is the challenge? Like how much older nurslings? Because we probably have a lot of advice depending on what the challenge is. So when you are working, so that mom wants to give us some more advice, we could maybe give some more. He's 16 months old. Are you having challenges? Oh, yeah. So that they, with breastfeeding the older babies, a lot of times moms will call it breastling because you feel like you're trying to nurse, they're trying to flip upside down, and he's aggressive only on the one side, but does okay on the other. That could be like a milk flow issue that he's trying to get another letdown. Or it could, even at 16 months old, it could be that there's some tension there that needs to be addressed. Like, do you have any suggestions for? I mean, at 16 months old, he could be teething. So maybe there would be like some comfort measures with that.
Um, yeah. Is it when she said on one side, I was picturing that she was nursing both babies at the same time. Is that
Those are twins.
what she meant?
She just said older nurslings. The baby's 16 months old and he's really aggressive on one side and teeth grazing.
Right.
So again, like, has this baby had an oral assessment? Are there oral restrictions that are showing up now as the teeth are starting to come in? So this baby could, anytime there's something like this where a baby's having some challenges that show up all of a sudden, I will often recommend body work. It's like a little tune up. You can go in,
Hmm.
get some
And just see what's happening.
done, and sometimes that's enough. Sometimes they have a big growth spurt, and
Yep.
then there's some tension there as they need to kind of move in their new body habitus. So yeah,
Yeah.
you
So
have,
he had a tongue tie revision.
yeah.
Right.
Sometimes those old muscles,
Like a little tune.
like they're gone all with a growth spurt, and then like especially with teething, have it back up again. So my go-to is that's when I would want a tune-up. I would want another session of body work to see.
Hmm.
Don't you think?
Yeah, definitely. I mean, I've seen that happen before where, you just need to, like you said, like just fine tune, figure it out. And usually the body worker can see, quickly what happened. But yeah, if he had body work before, I would reach back out to whoever you saw and maybe they could give you some suggestions.
Yeah.
I know now it's hard. It's been hard for us because we can't put our hands on babies. I'm itching.
Things are starting to open back up here more in Phoenix, but a lot of our body workers, chiropractors, some of the therapists have still been seeing some babies on, definitely a more limited basis. One of the chiropractors I work with, which I think she's on here, I think Dr. Becky popped on here at one point. She was going to their home and actually doing body work outside.
Oh,
It's
wow.
too hot now, but when the weather was nice, she was doing body work like in their front yard with
Wow.
patients, and got her a lot of really great feedback with that. So yeah.
What a cool idea. Yeah, no, I haven't had anybody in my office since early March,
Yeah.
and just trying to figure out sort of how we're going to do this. Um, has been, yeah, just it's the topic, the hot topic right now. Like you said, once things start opening back up, physical therapy was always considered an essential service. But because I work with such young babies, I just didn't want to take any kind of a chance because you just never know who's coming in and who's had contact with who, and it was just too many unknowns. So we decided not to see patients here. And I've been doing a lot of things virtually, and you and I were talking about it earlier that like it's actually worked out a little better than we expected because we rely so much on that physical contact. Um, but there's still so much that parents and the babies can learn to do just from a virtual session. So it hasn't been totally on pause. Um, but yeah.
Because even when I'm doing an in-person consult, like I do love to get my hands on a baby at least a little bit because I can feel where some of those tension patterns are and how the baby's
That's right.
moving and holding their body. And so I would do like maybe carry the baby to the scale, weigh the baby, and I'm always kind of like looking at him like, is one eye opening more than the
Mm-hmm.
where's any asymmetry, like kind of letting them move around and weigh them and doing the oral assessment and then, maybe picking them back up and handing them to the parent. And so now
Yeah, it gives you a lot of information.
it does. And, I still do an oral assessment, but I, of course, wear gloves and I'm having the parents put the baby on the scale, pick the baby up. So trying to just not really touch the baby a whole lot in person. And so then with virtuals, we were talking about that, like it can be a little bit intimidating to think like, okay, I can't touch this baby, I can't feel what's going on. But even in person, I'm very hands off because I want the mom to do the work so that she has that muscle memory of how she put the baby to the breast and how she latched the baby on. And if I do
Yes.
have to get in there and kind of help a little bit, then I'm sure that the mom gets a turn like on the other side. And so with virtual, like we're really, really, really having to give the parents the skills to be able to do a lot of this on their own. And I'm always surprised at like how well it does end up working out and like the good feedback that we get. We talk to them a couple days later and they're like, oh my gosh, it's going better. And I'm like, okay, goodness.
Yeah.
So
Yeah, you're right. And you're right because, you mentioned it earlier that like I've had parents come in and say, the lactation consultant came and we latched and we had a good feed, but I just can't put pillows that way when I'm by myself. So it's good to have them figure it out by themselves because then that's what they can do when we're not around.
and I also think babies breastfeed better when we're there because the mom is like, somebody's here to help me, like a little
Yeah.
and they're a little bit more relaxed. And so they're like, it went well because you're here. And I'm like, I totally understand that. And I do hear that a lot, that you just have to know that if you just take a deep breath and know that it's going to work out and it's going to get better.
Yeah.
I tell people it's like learning how to drive a car and you're
Yeah.
white knuckling it at first, having to think about every little step. And I was just telling a family that I did a virtual follow up with today, and their baby is having a frenectomy on Wednesday or Thursday, I think Thursday maybe. And I said, okay, so now we've gotten to this point and breastfeeding is starting to get better. And you're still having some issues, but we've made progress. And so when the release is done, it's going to be like making you drive someone else's car.
Yeah.
You're going to get in,
It's true.
I'm driving, but
It's different.
I got to move the seat and, this car is bigger. Like, you're just going to feel like you're driving someone else's car. So give yourself a day or two to get used to that. And they
Yeah.
that analogy. So
Yeah, I like that too. I might use that.
it's like I have a Mini Cooper, it's a 5-speed. So whenever I get into someone else's car, I drive my daughter's car that's not, like, it takes me a minute to reorient
Yeah,
myself to
it's so true.
go.
Yeah, and I mean, I always say that breastfeeding is like a dance where, mom has to learn her steps and the baby has to learn their steps. And then you got to actually put it together to make it look good. And so there's definitely a multi-step process that, usually it's not just, oh, look, it happened perfectly. There's always some fine tuning that has to happen.
Yeah. And someone else said that they need help with reflux, and the baby is gulping a lot of air, and the baby's only 5 weeks old.
5 weeks old.
Um, that could be positioning. So if mom is sitting forward too much and gravity's pulling the baby away from the breast a little bit, they're not going to have as good of a seal, so they're going to gulp air. And so there are some babies that have true acid reflux, right? Like it's the acid coming up. And some babies have reflux symptoms that's just from the air that they're swallowing. It's aerophagia.
Yes.
And so leaning back so that the baby, can get a little better seal because they're resting on the mom and gravity's not pulling them away can sometimes help. But also, like, I would definitely say body work because there could be something going on with that baby not being able to extension very well. And then an oral
Yep.
to see, are there
Yeah.
oral restrictions? Is the, tongue not able to extend and cup and maintain that cupping? And so I don't know, like a lot of times
Exactly.
we hear it, like we can hear clicking, we can hear the slurping.
Exactly. When the tongue isn't working effectively and it's not sealing to the nipple, the tongue should be the primary seal and then the lip should be the secondary seal. And if there's a lot of gulping and air that's creeping through, it's likely that one of those two things is not working, probably both. So definitely an oral assessment is so important for us to see what muscles are coming on, if there's a proper seal, if the tongue is effectively transferring the milk, are they just gulping air? So I highly recommend either, body work or at least an oral motor assessment by someone who's trained in tongue ties to at least get a better idea of what's going on.
I'll post on my Instagram. I have a really great video of good cupping. I actually did a consult with a baby and I was like, oh, like this baby has a great latch and the tongue had great extension and great cupping. So I took a video of it. And then I have a couple of videos of babies that have oral restriction and you just see that tongue come out and then, my fingers in their mouth and the tongue's just going.
The tongue drops. Yeah, that's where you get the click because the clicking is the tongue falling off and breaking suction. So you get a click.
Yeah. Yeah.
Mm-hmm.
It should be like a taco shell around,
Exactly.
or a hot dog bun around the hot dog. And there should be this frontal peristalsis. The tongue should be going back and forth. This. So.
Right. That nice undulation.
Mm-hmm. And I'll post, I have a couple videos that I like to use that, and I'm sure you do too, but yeah.
Yeah, I try to post them every now and then too. I know I try to get before and afters, but it just never, the perfect one hasn't come along.
Yeah. I do have one that the tongue was just moving with the jaw and just, falling, going up and down. And then this wasn't her first baby and she suspected tongue tie. And so that baby was pretty much ready to go and got the release done like a day later or something after I
Wow.
went there. And I went back on day 5 and took another video and I'll post that because you can see the difference. I mean, there's still some work that needs to be done, but
Yeah.
it wasn't perfect. But it just in that 5 days, you could see that all of a sudden that tongue was starting to free and move independently from the
from the jaw. What I always tell parents is the tongue is like the major mover for feeding, just like biceps would be if you were carrying like a heavy grocery bag. So when the jaw is doing all the movement, it's like carrying a big heavy grocery bag with your pinky fingers. That's not what it's designed to do. It doesn't have the strength or the stamina to be able to carry out feeding. And that's why it becomes super inefficient. The baby falls asleep, the baby gets frustrated, they're popping on and off, they're not comfortable because they're just not, that the muscles of the jaw were not designed to be feeding. And like you said, once that tongue is freed, and a lot of times I just have to go in and show the tongue the right way to move and to operate to become that major mover, then all of a sudden the pain goes away and they start to become more effective. And I would say the process takes about 2 to 3 weeks. Generally, if there's any kind of jaw issues, if the jaw is retracted, if it's really tight, what else? I had these things written down here. If it's clenched or retracted or asymmetrical, or if it's really slack and it's hanging open, then those babies can take a little bit longer. But generally, it's a fairly quick process to retrain and rehab, so to speak, the mouth to start functioning correctly.
What would you say to someone if they told you that maybe their pediatrician told them the baby had a mild tongue tie?
Dr. Cutlow, I think he's the one that says that, you either have a tie or you don't. It's like saying that a woman is mildly pregnant. I mean, you're either pregnant or you're not. So, that's why we really do link it to function. You know, so if there's a tie there, there's a tie there. Whether or not it's affecting function is really what we look at. Because there are people that do have a tie, but they can get along okay,
Mhm.
you know, and those are the ones that will go into earlier, you know, toddlerhood, childhood, and then sometimes you'll see that the teeth grow in crooked or there's some crowding, they might have some speech issues, they may not. But I always say, you know, you have to make that decision based on function. So if there's no issues with the breastfeeding, but there is a lip tie, at this point, I would just kind of kick the can down the road and wait till you're seeing issues. You know, I think that there's controversy there, but that's always my approach.
You know, and babies can, like you said, can a lot of babies can breastfeed with a tongue tie. And often there's one presentation where the function is so limited, regardless of if the tongue tie is attached to the tip of the tongue or what I call the sneaky ones that are more posterior and
Mm-hmm.
under the mucosa, not as visible. I think those are the ones that a lot of people will call like a minor tongue tie. And so for some moms, the presentation is right away. Like she's got cracked nipples.
Right.
It's super
Pain.
full. Maybe the baby isn't gaining weight well, but that's not always the case because sometimes mom just has a ton of milk that's flowing and the baby's on there just gulping, gulping, drinking, drinking, drinking. And so those are like the red flags that we see right away. And usually that's easy for those parents to make that decision because it's like make it or break it. Like we cannot nurse through cracked bleeding nipples. And then there are those babies
Mm-hmm.
who have a tongue tie and maybe mom's milk supply is, you know, ample and that baby, it's really robust. The baby's just, you know, not latching. They're just drinking the milk that's pouring out to them. And those are the babies that sometimes gain weight really quickly. And maybe they have the gassy, colicky, refluxy babies because they're just swallowing so much air. And then when the milk supply starts to downregulate at between 6 and 12 weeks, then that's when the pain starts because then the baby's never really had to latch to transfer the milk until the milk supply downregulates. So that's another presentation. And then
That's
sometimes
right.
mom and baby make breastfeeding. They somehow fit those puzzle pieces together. And we don't really see the issues until like that 12-week, that shift of the hormones and the milk supply all of a sudden starts to decrease because the baby never really had an optimal latch.
Yeah.
Tell people it doesn't matter if the baby's tongue is really tight, like someone has their arms tied tightly behind their back, or the tongue has some movement, or maybe someone's called it a minor tongue tie, and we have the hands tied back loosely, but the hands can only get to about this point. It doesn't matter where the hand is if it's tied back and restricted and you can't feed yourself. It doesn't matter
Mm-hmm.
how tight it is, right? So,
Yeah, there's different classes of ties
mhm,
because it, you know, there's different degrees of it, but a tie is a tie.
yeah.
And I, on a personal note, wow, it's a long story that I won't get into, but I had a brain tumor when I was young, and they removed it. It was sitting on my pituitary tumor. They didn't think I was going to be able to have children. I was able to have kids, but I didn't really make any milk. And so I didn't know my son had a tongue tie. He did click a lot on the bottle. This was 10 years ago. I had no idea. And he struggled with reflux and a lot of stuff. And I finally got his tongue tie revised when he was 8 years old. Dr. Siegel in New York City did it for us. And, but yeah, he has, you know, he was in speech therapy for a while and, you know, he had all these things, but I didn't know because I just, for me, I wasn't able to breastfeed. So I didn't know. Um,
Well,
but anyways, yeah, it doesn't go away just because you don't notice it when they're nursing.
yeah. My husband had his released at the age of 52 for jaw pain and headaches,
Yeah.
and so someone asked about, are all IBCLCs trained? And same with like you were saying, a lot of physical therapists focus on like older children and adults and not really like babies and breastfeeding.
Yeah.
So training to learn about oral function is very minimal in the IBCLC certification process. So
Mhm.
for most of us, it is what we've learned after we've become either, for me, an IBCLC. I was a labor and delivery nurse for 18 years, and no one ever trained me to look for a tongue tie.
Right.
An oral assessment
Exactly.
check the palate, and nobody ever taught us to swoop under a tongue to look. That was never a part of that training as a nurse.
Right.
And then I became an IBCLC, and I do remember there was a question on the exam, but it was a frenulum that was attached to the tip of the tongue. So it was like one that was very obvious,
An anterior, yeah.
but like very minimal. And it wasn't until I went to the International Affiliation of Tongue Tie Professional conference, 4-day conference in Florida in 2013. And when I was told about this conference by Dr. Rajiv Agarwal, who he's famous in the tongue tie,
Yeah.
and he owns Agave Pediatrics, which has several locations here in the Valley. He told me, you need to go to this conference. And I was like, 4 days on tongue tie? Like, I was like, okay, I've got to go just because it's so ridiculous. A 4-day conference, like, obviously I'm not getting it. Like, now I have to go. And I went and I was blown away. And I'd been practicing as an IBCLC for about a year and a half. And I was sitting there in the conference just devastated, thinking about some of
Everybody.
my clients that I had seen that we were stumped and
Right.
didn't progress or whatever the case may be. And when I came home from that conference, there were about 8 families that I had worked with recently that I called back, had them come back in and sent them to Dr. Agarwal.
Wow.
I was pretty sure
Yeah.
that was what
Yeah.
was.
And I say the same thing. I mean, I have a doctorate in physical therapy. I did a lot of school, but I never learned about any of this until I did postgraduate courses that really focused on how to find it, how to assess for it, what to look for, what should feeding look like. And it really has changed how we practice. There's somebody, Regiane 524, that is saying that her baby was 6 weeks premature, I think, with colic and reflux, and that she's struggling so much and hard to nurse, hard to latch. I definitely suggest that you see somebody for an oral assessment. I have been doing virtual stuff, so I'm happy to help. You can DM me.
Yeah.
And we can try to go through things together. I don't like the word colic. I think we're all on the same page with that. I feel like that's a term, it's a cop-out excuse to say, just deal with your baby crying. We're not going to figure out what's wrong with them. But very rarely will a baby cry if they're not in some kind of discomfort. So
I always call it like colicky-like symptoms because, yeah, that unsettled baby. Yeah, I definitely think like this would be something that you would want to work with someone with and
yeah.
have your baby have an oral assessment. So we're almost out of time. So I want to ask you, so both of us have social media accounts where we try to post really relevant information. We both mentioned Tummy Time Method as a really great Instagram as a resource. What is your other favorite resource on social media to tell parents about?
Oh man. That's a hard question. I don't know that I could give you just one on the spot like this. But I love your account. I find that I come here a lot. And then I don't know off the top of my head. I got to think about it.
Yeah. Both really like, Tummy Time Method for sure. That's a great
Yes.
resource for parents. And I actually thought of one and completely, I just lost what I was going to say. I had this account that what was I going to say? I feel so bad. Oh, I can't think of what it was.
I know.
Anyways, reach out to us. You can DM either one of us if you have any more questions.
Yes, absolutely.
I'm doing a virtual support group. So it's every Tuesday at 10 o'clock. So tomorrow morning, 10 o'clock Arizona time.
Excellent.
If anybody wants the link for that Zoom meeting, they can DM me and I'll send you the link for it. Dr. G, like Dr. Gahari, his Facebook page is really good. Really, really, yeah. I mean, really, he's got some amazing.
Yeah, his website is good. He's got a lot of videos.
I use
Thank you.
the website a lot. Yes, thank you for that. For that. I do use his website a lot because he has great videos. And as an ENT, he is, very, he can really speak to pediatricians if a pediatrician isn't so sure about what's going on with the baby. Dr. Gahar has videos, and yeah, definitely.
Yeah, it's a good one. Thank you. It was such a pleasure talking today. I feel like we could go on and on.
At least, like, some great information, and to know that you're doing this on the other side of the United States, and working with IBCLCs over there, and then like I said, over here on the West Coast, we've got some great resources here, and definitely a lot of my clients, I refer them to Chelsea, and she teaches the Tummy Time Method class here, and she's doing it virtually right now, but when we're allowed to have groups, she does it at the Motherhood Co, where my office is in Phoenix.
That's amazing. Yeah, it's great. I have to get mine off the ground.
Well, pick Chelsea's brain. She's a great person to.
Yeah, I just might.
Yeah, very good. Well, thank you so much. And
thank you for having me. And this was great. And I'd love to do it again.
Yeah, I'll post those videos on the tongue function. Let me know.
Yeah, make sure you tag me so then I can share them as well with my circle.
Awesome. Oh, I love you too, Chelsea. Well, if you want to come to Phoenix and enjoy some good summer weather, let us know.
Yeah, for sure. And then we'll definitely meet at the next conference if it's actually ever going to happen.
Yeah.
They canceled ICAP, so.
Yeah, definitely. So that's, what does ICAP stand for again? It's the international, it's the tongue tie organization. And
yeah, I can't think of
what it's called.
I know.
Can't wait for them.
I can hear my kids screaming upstairs, so that's all I hear right now in my head. So I'm gonna get going, but
hey, have a good night.
Thank you so much. It was such a pleasure doing this together. Thank you. And we'll connect again.
Sounds good. Thank you so much.
All right, take care. Good night, everybody.
Bye.
Bye-bye.